Good morning. Hi everyone. I am Dr. Nagarjuna Maturu, Consultant Interventional Pulmonology at Yashoda Hospitals, Hyderabad. August 1st every year is recognized as World Lung Cancer Day. In India and across the world also, lung cancer still remains an important cause of cancer related deaths. This is mainly because we diagnose lung cancer at a very late stage when we cannot cure the disease. So there are two things I would like to stress. One is prevention, second is early diagnosis. So for prevention, this has been emphasized time and again. Smoking is the most important cause of lung cancer. People should not smoke. There is no safe limit for smoking. Even one cigarette per day can cause lung cancer. Two, there is no safe cigarette. Cigarettes, BDs, hookahs, chutta, everything, all sorts of traditional form of cigarette are equally dangerous. So smoking in all forms and smoking in any quantity has to be stopped. Second is early diagnosis. Here there are two things. One is we should not neglect the symptoms of lung cancer. So which means if a person has cough, bringing out blood in the sputum, chest pain, breathlessness, weight loss, appetite loss for more than 2 weeks, he should definitely meet a doctor and get himself checked. Any symptom beyond 2 weeks has to be evaluated. Second important thing in early diagnosis is the newer technologies which we have. Now even if we find a small nodule or a small lesion on the CT, we have a dedicated tools called as navigational bronchoscopy and lung biopsies, wherein we can diagnose the lung cancer at a very early stage so that we can treat them better. So prevention and early diagnosis are most important if we have to improve the lung cancer mortality. Thank you.